Welcome back to the second half of NEWSBREAK Live, and joining me is Dr. Garth Green from Providence Little Company of Mary Medical Center. Thanks so much for being here.
My pleasure. Thank you for having me.
Doctor, October marks Breast Cancer Awareness Month, and statistics by the American Cancer Society show that 252,000 women will be diagnosed with invasive breast cancer before the end of the year. But the good news is that women can survive this disease if detected earlier. Is this true?
Absolutely. As part of this, this month, October being Breast Cancer Awareness Month, I think it's important to kind of reinforce some of the principles to help patients kind of find this early and be their own advocates. So I think patients need to be vigilant. They need to be active in their health care, which means knowing about their medical history, their family history, making sure they see their physicians on a regular basis to do breast exams, but also really kind of being aware of their breast and kind of bringing up any new physical findings or symptoms that they may have to their doctor. Doing that, I think they should be in good shape.
Okay, and as a radiation oncologist, what age do you usually encourage women to get more mammograms often?
So there are conflicting kind of guidelines about this. There's multiple national organizations that have put out their own guidelines, and they vary a little bit in terms of when to start, how often to do it, and then actually when to stop. But on average, most women will start getting mammograms at the age of 40. But this does depend ultimately on the patient's risk of getting breast cancer. The lifetime risk of a woman in the U.S. getting breast cancer is about 12%, so that we would consider average. But there are some women, based on genetic abnormalities or other medical conditions, or even models that are used to kind of predict risk, where they might be at a higher risk. And those patients will actually start getting mammograms at an earlier age, sometimes as early as 25, but usually kind of in the early 30s.
And what are those medical conditions that may have younger women to go out and get these mammograms earlier?
So probably the most important one is genetic mutations. The classic mutations are called BRCA, and they're mostly tied to family history. The majority of women, however, who get breast cancer do not have a genetic mutation, but those that do, it's important to identify them so they can get started on surveillance early. There are women who have had radiation at a young age, who ultimately are at higher risk of getting breast cancer, who need to start screening earlier. And there are some women who have had breast biopsies of certain kinds of diseases called atypical ductal hyperplasia, some other things like that, who also might benefit from getting started earlier.
Are there any steps women can take, I know you mentioned a few earlier, to decrease the chance of getting the disease?
Yeah, I mean, for a woman that's at average risk, which again the majority of women in this country are, lifestyle changes can help. So being active, having a healthy lifestyle in terms of diet and exercise can definitely help. Women who are at higher risk, though, can be treated more aggressively. So women that have genetic mutations actually will be treated with surgery commonly. So both breasts will be removed often, and sometimes the ovaries as well. Most women, even at higher risk, don't usually need to have that kind of therapy, but sometimes can be placed on medications to reduce risk.
Do you often see women going years without getting mammograms? I mean, is this the emphasis that you place during this month for women?
Yes. I mean, for my perspective, from what I do, I end up seeing patients who are being treated for cancer. So my job usually after that is to keep following them and make sure they get their mammograms. It's harder for me to reach out to the women that haven't had them yet. But yeah, I see many patients who are diagnosed with breast cancer who haven't had mammograms for a few years, sometimes, many years.
Can men get breast cancer? I guess this is something we don't think about usually.
Yes, they can. It's much less common, and honestly, it's kind of stigmatized. Most men are embarrassed almost to find that they have a mass in their breast and feel uncomfortable bringing it to the attention of their physician. But ultimately, there are a minority of men who can get breast cancer and typically are treated similarly to women.
Are there symptoms for women and men that may cause them to go into the doctors to see that maybe they have breast cancer?
Sure. I mean, the most common thing would be if you feel a lump or a firmness in an area. That's probably the most common presenting symptom that patients will go to the doctors for. Having a discharge or bleeding from the nipple is another. Although a lot of patients bring up pain, pain isn't usually associated with it. But sometimes women will also see dimpling in the skin or sometimes other changes in the skin that can be suggestive of having breast cancer.
Okay. And we were talking about mammograms earlier. For women who haven't had, or for men or women who haven't had mammograms yet, tell me a little bit about the process, because it sounds a little intimidating for most people.
Well, basically, it requires a doctor's order visit to a diagnostic imaging center. The breast is typically placed in the mammogram unit. It is compressed because by doing that, you can actually get a better look at the breast. And these days, what's become standard of care for a lot of facilities is using digital mammography, which has improved it and made it a lot easier for the radiologists to read those films. And that's also being combined these days with something called tomosynthesis, which is another way to better find cancers, especially in younger women with dense breasts.
And as someone who treats patients with breast cancer, what are some of the latest treatments offered to patients?
Well, not being a surgeon or a medical oncologist, I'm not up to speed on everything that's new in their kind of practices. But I can tell you that in general, things have improved so much over the years. Now, surgeons are able to do mastectomies and spare the skin and sometimes the nipple. They can make very nice reconstructions of the breast with tissue flaps. Medical oncologists have multitude of new drugs that are very helpful. Specifically Herceptin, which is a drug that targets a specific receptor on breast cancer cells. Some patients who receive that can have surgery and have no residual cancer. In my specialty, what's really changed over time is we were starting to treat patients with fewer fractions of radiation, less amount of radiation, and actually smaller areas that we're treating. So in general, it's making treatments better and less toxic and more convenient.
Okay. What sets breast cancer apart from other cancers?
Strictly speaking, not a lot, other than the fact, it starts in the breast. It's one of the most common types of breast cancers. The main thing that really sticks out with breast cancer is it does have estrogen receptors on the cancer cells in many women, and that really helps dictate treatment, and they predict for responding really well to certain kinds of medications. Most other cancers do not have that type of receptor and can't respond to those kinds of medications.
Okay. And for patients who are doing research on services and resources, what does Providence Little Company of Mary offer to them about this disease?
So Providence has a really mature and a high-quality breast cancer program. It starts with the radiologists and the diagnostic imaging tests. As I mentioned, there's digital mammography with tomosynthesis, ultrasounds, MRI scans. There are dedicated breast surgeons and plastic surgeons that are taking care of breast cancer patients on a daily basis. There's medical oncologists that have access to all the new medications and actually clinical trials. And then there's myself and doctors that I work with who actually have the new equipment and can deliver these kinds of treatments that I was just talking about.
Okay. For women who have breast cancer right now and are going through treatment, what are some good ways they can stay positive and stay motivated during this time?
A cancer diagnosis is difficult no matter what the primary is, and the key, in my opinion, is to really keep a normal routine, try to limit the disruption to your regular life. Being active, exercising can really be helpful. It can elevate mood. It can actually increase your energy. And obviously, family and social support is really important. And we're lucky in this area for patients who really don't have good access to that. There's the cancer support community in Redondo Beach has great programs, free group therapy, individual therapy, and other programs that are really helpful. So I would recommend that highly to anybody who is interested.
And for viewers tuning in right now, October is Breast Cancer Awareness Month. Doctor, is there one step that you really encourage men and women to take to see if they are healthy and if they have breast cancer, especially since it's a topic that people might be scared to discuss with others?
Sure. Again, I think it's really important people take care or take charge of their own health. So it's okay to kind of check your breast to make sure there's nothing that feels abnormal. It's okay to bring it up to your physician. It's really advocating for yourself to your physician, I think, is really important. So just being on top of that, I think, is a good start.
Okay, thank you so much for
Sure.
joining me.
My pleasure.
Well, that does it for NewsBreak Live. If you ever have news or video that you'd like to share, please email us at newsbreak@torranceca.gov. And don't forget to tune into the Torrance City Council meeting tonight. For Facebook and Twitter users, use #NewsBreakLive. Have a great night.